Hello, everyone, and welcome back to School of Speech presented by Speech Therapy PD. School of Speech is designed for all of us school-based SLPs to come together so we can learn, think critically, shine the light on everything that we do on the daily. I'm your host, Carolyn Dolby, and I am so glad you're here. Today's episode is titled Leveraging Supervision and Evaluation to Succeed as a School-Based SLP. Now, I know that the words supervision and evaluation don't always spark excitement, but you just hold your horses, people, because we are going to reframe them, right? If supervision and evaluation aren't just compliance systems, but what if they are tools for advocacy, clarity, professional growth? If you have ever found yourself thinking, why does my evaluation feel like it doesn't reflect what I'm actually doing? Or how do I advocate for the time, caseload support, and for professional development? Or how do I sustain this career for the long term without burnout? Well, friends, you are in the right place because here today is what we're talking about. I am so excited that I am joined by Dr. Jacqueline Brown. She is an assistant professor in the Master's of Science in Speech Language Pathology at the University of New Haven. She has worked across schools, acute care, outpatient, and rehab settings. And her research, which we're going to be talking about today, focuses on professional experiences of school-based SLPs, particularly in relation to educator evaluation systems. Jackie, welcome to School of Speech.
Hi, Carolyn. Thank you so much for having me.
Oh, it's a treat for us. It is a treat for us. We are so happy. I know we're going to dig into this conversation in just a minute. I have a few little housekeepings as I always need to get through. I've got just our disclosures right quick. I'm a salaried employee at Portland Public Schools here in Portland, Oregon. I'm also a co-founder of A Place to Start Therapy, and my favorite of all favorite jobs, hosting a School of Speech. I do get compensated from Speech Therapy PD. Dr. Brown is compensated by the University of New Haven and does receive release time to conduct research, and she has no non-relevant relationships to disclose. Okay, done with that. Look at where we're all, I love that we're all over the place. All right, so I know that this is a great topic, and I know a lot of us are here, and let's get in, but I kind of want us to zoom out before we get into supervision and evaluations and all of that. I really think starting us off talking about special ed law.
Yeah.
Like, how has the law influenced our roles and responsibilities in public schools? Can we start there? I know that's a big ask, but I think that will set us where we need to be.
Yeah. And I think that speaking about the law and how it has changed our roles is extremely important when we talk about supervision and evaluation, because what speech language pathologists were and what we did when the profession first started has increased, right? It has grown so much. Our role keeps on expanding. And that has been largely informed by special education law in public education, right? So in K through 12, and I should say pre-K through 12, right?
Right?
So we started off with working in specifically fluency and speech correction, right? That's who we were. We were speech correctionists at the beginning. But working in the schools was largely focused on working with students who stuttered and had articulation and phonological disorders. And that started growing into language, because then came 504 plans, IDEA, right, which initially IDEA was meant to include students in education, right? We had students who were institutionalized because of their disabilities, and that shifted when we had the Education for All Handicapped Children Act. And that then said, well, now we have to include these students in education, and we need to provide support to help them succeed and grow with their peers. Right? That then became, so some people abbreviated EAHCA, and others say EHCA, right? So the Education for All Handicapped Children Act became IDEA, so Individuals with Disabilities Education Act. And it was under IDEA that we had individualized education programs and the enforcement of the least restrictive environment, right? So we're all familiar with that terminology when we talk about IEPs. And so that then shifted our role, and we became a little more into this we started to come into this administrative role where we were preparing paperwork and scheduling meetings, right? And becoming part of that team that collaborated to help establish supports for children. And that also began to require that we include parents in our planning, right? So we wanted to include that education component and ensure that parents understood what we were doing in the therapy room and to start having some carryover outside of the therapy room. So in 1990 and 2004, it was when EHCA became IDEA, and that mandated inclusion, right? So we're familiar with those terms of inclusion. Mainstreaming is another term that we use. And so we had now not only children with fluency disorders or phonological and articulation disorders, but we had children who were nonverbal, right, in our caseload. And our role grew then to not manage behaviors in a way that we had not done so before, right? So we had to work with children who had different challenges, greater challenges, because they were unable to communicate even minimally. So that impacted a lot how much of the work we were taking on at that point, right? So these laws specifically changed really the scope of practice and the demands of school-based SLPs. And we slowly shifted into the different aspects of language, pragmatic disorders, social disorders, right? And working more in those realms. Now, with the changing laws also came regular education laws, right? So if we want to call them that. So if those of you who remember the No Child Left Behind Act, right, under the
Yes.
Bush administration, we had No Child Left Behind. And if you look at the history, a lot of what people will say is that it was under that law that we started to have a lot more of a focus on supervision and evaluation, because we really wanted to change how teachers were performing, right? We thought that that's what supervision and evaluation would do, and it would increase the quality of education, the quality of educators, and it would change the outcomes for students. However, I do want to note that there was no mandate or requirement under the No Child Left Behind Act to conduct supervision and evaluation, right? So it didn't mandate schools to change supervision and evaluation. However, schools felt that that was the way to go, right? So No Child Left Behind became the Every Student Succeeds Act under the Obama administration, right? And that the main goal of the Every Student Succeeds Act was to prepare students for secondary education and work beyond high school, right? So we wanted students to leave high school with the skills that they needed to become part of their communities and to contribute to their communities. And under ESSA, so that's the Every Student Succeeds Act, is where the laws or the focus on education loosened up a little, because we now wanted to focus more on the outcomes overall, right? The other two changes that happened between these two laws, between No Child Left Behind and the Every Student Succeeds Act, were that with No Child Left Behind, the focus was on student performance on academic achievement tests, right? And that's what we call value-added assessments. And that
Is it really value added? Sorry, I don't mean to be
yes.
cheeky.
So we call value-added assessment, and we really did not see, right? So ASHA, I should say, did not see the value of value-added assessment in measuring the work or quality of speech language pathologists, right? So it wasn't a reflective measure of our practice. So at that time, when value-added assessments were being used, I want to point out that ASHA prepared a document that could be used to assess speech language pathologists. And so maybe some of you who are here have used or heard of PACE. Maybe it is new to you. So I am going to put the link to the ASHA page for PACE. So PACE is the Performance Assessment of Contributions and Effectiveness of Speech Language Pathologists. And this is such a comprehensive document and is just so amazing. I did not know about it when I started working in the schools and when I left the schools. I came across this document by mistake. And so
I love those little mistakes that happen that end up
yeah,
being amazing.
you're
Yeah.
scrolling through the ASHA website one day and you're like, wait, there's a resource for what I've been going crazy about, right? So PACE is the system that was developed by ASHA so that administrators who do not know what speech language pathologists do could have a tool that they could use to assess the work of speech language pathologists accurately, right? So because under the Every Student Succeeds Act, we no longer needed those standards-based assessments. So PACE would help administrators evaluate SLPs. And under the Every Student Succeeds Act, we no longer needed to show that we were evaluating educators, I should say, in general, right? So we weren't evaluating educators at a certain level or, but we still needed to show progress. So this system had been in place before ESSA came into the picture. However, even though ESSA didn't require evaluations are still there, right? And one of the cruxes we find in the literature is that, there's evaluation, and this is not only true for speech language pathologists, but if you look at evaluation literature on any profession, on any educational profession, you will find that the problems are that evaluation is actually not tailored to your role, right? So that's a problem we all have, school psychologists, social workers, et cetera. And evaluation doesn't really feel like something helpful. It feels like a chore. And one of the many things on our to-do list that we don't want to do, right? Because it just adds another level of paperwork. So PACE came in so that we could have a tool, right? And so this, to me, just brought up questions about how is evaluation supposed to help people? And is it really helping people, right? And so around this time, I found PACE and I found it. So here, this paper was by Kelly Farquharson and colleagues, and the title of it was How to Recruit, Support, and Retain Speech Language Pathologists in Public Schools, right? So we were really looking, or she was really looking, and her colleagues were really looking at what things administrators could do to keep SLPs, right? Because there is, I'm sure you can speak to it in the states that you are. In Connecticut, there's high turnover rates, especially for new grads not sticking around for a long time. And partly it might be, there's no direct correlation here, but it might be because we're not getting the support that we need, right? We're not getting perhaps the time that is necessary to do all of the tasks in a manageable manner.
Let us know. Do you feel that? I'm going to say I feel that, like, not always supported because I think sometimes we're not, I think definitely administrators, unless they're speech paths themselves, don't truly know what we do and how we do it and what we need. And I think it needs more clarity of exactly what we bring to the table.
Yeah, absolutely. And I think also, the other part of this was I just wanted to better understand where supervision and evaluation could be seen in a better light and could help people, right? So this work then led to me developing a survey that was specifically tailored for speech language pathologists in Connecticut. And so the majority of the questions were meant to understand the different aspects of evaluation. And I paired the survey with a with an interview. So I had a group of SLPs who agreed to be interviewed, and I thought that that would be a good way to obtain data that was more loose and
Mhm.
less influenced by me, right? So this is a paper that kind of really just started with me thinking, well, I think that Kelly Farquharson's paper has a lot of value, and I think we need to find out more, right? And so I developed this survey, and we had not a lot of participation, but just sufficient to get something, meaningful here. So we had about 38 participants in the survey and 7 interviews that lasted about an hour. And in that data, what I wanted to know was what tools were being used to assess speech language pathologists. So is it a tool that's tailored to their needs? Does it represent the work that they do? Who is their supervisor or evaluator, right? Is it someone who is a speech language pathologist or someone who does not have a background in speech language pathology? And what professional development opportunities come from supervision and evaluation, right? And now I don't know how many people are hearing that from the first time that supervision and evaluation is supposed to inform your professional development, right? So it's like when we
No, that's new to me. I'm sorry, Jackie. I'm stopping you because that's a brand new day for me, and I think that's why we're here. We want to hear exactly that and tell us more. Yeah.
Yeah. And it's the same as, when you evaluate a student and you create those goals based on your evaluation, right? You look at the whole picture and you think, okay, these are some places where I can really help this student grow, where I can really support their advancement in education, right? So the same is true for us. When we are evaluated, our evaluator should sit with us and say, here are your clear next steps, and here are some things that we can do to support you in your professional growth, right? Now, the other piece is I know that everyone here has at some point sat through a full day of PD of
Yeah.
information that had nothing to do with you, right? And you left that PD thinking, okay, well, I know now what the classroom teachers are expected to do. And perhaps even they at some point feel that I don't know if I even can implement all these strategies or can carry through with this program, right? To be fair, not to say like, well, it's just relevant to the classroom teachers. I won't say that, but you've spent the full day there and have left with nothing, right? So supervision and evaluation is a process that should be collaborative in nature. And you should have this relationship with your supervisor and evaluator that leads to an interchange, an exchange of communication that helps you feel like, okay, well, this is a job where I'm going to really make some strides, right? And everyone says this, speech language pathologists are super type A, right? Super motivated. We do 10 things at once because we want to conquer the world in some way or
True.
another, right? We want to leave a good impact behind. And so, but then we end up kind of losing out on that spark because all of the other tasks become so unmanageable, right? Large caseloads, a hefty workload, right? Which kind of separates itself from the caseload. And the constant need to communicate with one person and communicate with another and not having the time built into your schedule to do that. So those are things that can really be detrimental to your progress as a speech language pathologist in the school and in any other setting, true, right? That can also happen outside of the schools. So when I collected the data on what was happening with school-based speech language pathologists in Connecticut, I found that the tools being used were largely in Connecticut. I should clarify, we do have a rubric that is for support personnel, right? So we term it for support personnel. So that covers school psychologists, social workers, speech language pathologists. So that rubric was used by some people, Most reported that the teacher rubric is being used, even though the other rubric exists. And no one reported using PACE, right? So this was in 2023 that the survey was conducted. PACE has been around for 11 years at that point, since 2012, and no one used PACE. However, there was one district who had mirrored an evaluation using PACE, right? So that was great to find that there was one district. And then the other part was, while speech language pathologists felt respected by their evaluators, they did not feel that their evaluators understood what their roles were, right? And so those are different things. So I can have a great and friendly relationship with my supervisor, but at the same time, I can feel that they don't know enough about what I do. And that can feel really bad, right? It can feel heavy. It won't make you feel excited to come to work, I'm sure. So I found this information and I thought that this was very important to know and to communicate to people, right? And so before my research though, there were a couple of other papers that had not been peer reviewed or published, but ended at the dissertation stage.
Mm-hmm.
So if anyone here has completed a dissertation in an educational doctorate, an educational doctorate is not a research-based degree, right? That's not the main focus. We learn a lot about education law and how to be a leader in the schools. That's typically the focus of an EDD, unless you have programs that are tailored to involve other components in there. So because the EDD is tailored for this, many individuals who go on to complete an EDD write their dissertation and then it kind of stays there, right? It doesn't go beyond that. So I do want to recognize there were 2 dissertations before mine where SLPs looked at evaluation systems, right? And so one of these specifically looked at how valuable SLPs found evaluation in early years, so years 1 through 5, versus later years of their career. And the majority of SLPs who found supervision evaluation were in those early years. And it's easy to see why, right? Because in those 1 through 5 years, you're really just learning the school system. You're learning the paperwork, you're learning how to communicate with the multidisciplinary team, right? You're building those relationships. So you can have a lot of input from a non-SLP. You can have your principal who has no background in speech language pathology telling you all about the school, and it's meaningful. Now, once you get to year 5, you're ready to do more, to take on more, to specialize, maybe do something, very specific. Carolyn, I know you do feeding, right? So
Yes.
you want to explore something new, but how do you do that if you don't have the support of someone who understands your role, right? So when I went to do my survey and asked questions of speech language pathologists, they mostly communicated that when they were supervised and evaluated, the feedback that they received was around how IEP meetings were run, right? So, oh, you ran a great IEP meeting, you included X, Y, and Z, the parents seemed to like you, you seem very organized, right? So that was the feedback consistently given in the interviews, right? So this is what SLPs reported receiving in their feedback through the supervision and evaluation process. So that can only take you so far, right? Because then you want to say, well, this year I'm working with a group of students who are nonverbal and I'm really struggling with behavior management. And I'm really struggling with finding the right intervention to meet their needs. And you don't get there because your supervisor doesn't understand that that's an area that also can be helped so that you can grow, right? So that those pieces from the research really led me to think more about, well, what happens at the national level? And so we talked about this. There's a paper in the works, but I did, and many people from California and other states contributed to that work. So hopefully you'll see it off the press soon. And in that data, we found very consistent information, right? So SLPs are evaluated with tools that are not applicable to them. A lot of SLPs are supervised and evaluated by individuals who do not have a background in speech language pathology. And a lot of the SLPs reported feeling kind of stuck in their roles, and none of the professional development, right? None of the professional development is relevant to their role unless they advocated for it, right? So unless they teamed up with their group of SLPs and said, hey, let's ask for a membership to the ASHA Learning Pass. Let's ask for a discounted membership to speech therapy PD, right? So unless they did that, there wasn't a clear path for relevant professional development. So in short, what that research shows is that the supervision and evaluation process is not doing what it's meant to do for speech language pathologists.
So, okay, yeah. I mean, I think I think a lot of us are feeling that, like, yeah, I identify with that. My evaluations I've been at a couple districts. One district was partly from the lead SLP and partly from the campus administrator when I was a campus SLP. And that was good. And then when I moved into the position I'm at now, I'm being evaluated by a non SLP.
Yeah.
Right?
Yeah.
And what was interesting, I was just having a conversation with an SLP last night, and she was literally talking because I told her what we were talking about today. And she was like, I was just thinking about evaluations, and wouldn't it be neat if SLPs could actually say how they would want it, like an evaluation to go? Like, what if I said, you know what? I have a lot of students on my caseload with stuttering, with verbal diversity, if you will. And I think I would like my evaluation to be, I want to prove that I see an issue or growth for me. I don't have a lot. I'm going to do that. I want to take this course or whatever, and I want to show some data on growth on what I've done.
Yeah.
That blew my mind. I was like,
Yeah.
that's exactly what SLPs do. That's what we should be sharing.
Right, right. And so here is my next resource. So
Yeah.
this is an older publication. It is from the Council of Chief State School Officers. And this is a document outlining recommendations for supervision and evaluation. So what is supposed to happen in this process, and how should people, both the supervisor and the supervisee, establish a relationship to succeed through this process, right? So, and I think that a lot of the information you'll read here is true for any work setting, right? You want to have a good relationship with your supervisor. You want it to be collaborative in nature. You don't want to feel like evaluation is being done to you, but done with you.
Yeah, you
Right?
don't want it to feel judgy. And I also think as SLPs, I think it would, like, I loved my SLP colleague Annie last night saying, like, it would be great if we could say, I want growth in here, but I wonder how many of us are like, I'm not sure I want to say I need growth, but that's exactly what we should be doing and advocating for. I need more support. I want more growth in this population.
Yes.
How? Give us some help.
Yes. Yes. Okay, so here are some of the pieces that are integrated in this document. Is that we want our supervisor to really understand and know what we do. So a really good supervisor, this is one thing that you'll find in a lot of the teacher evaluation literature, right? A good supervisor is the person who walks the hallways, steps into classrooms at random, and knows every teacher by name, every educator by name. Let's say it that way, right? Because
Yeah,
it
yeah,
includes us in that way. So it includes us and they know our name. They know what we do. They tend to pop into your session on a day that it's not for supervision and evaluation. They're just there to see what you do, right? And they are able to then look at you over multiple times and say, okay, this is what a great day looks like for Carolyn. This is what a day looks like when she had a lot going on and had to run to 3 PPT meetings in
right.
between sessions, right? So I know how I can support Carolyn
And
if I do
maybe know that putting me in the book closet wasn't conducive when the evaluator's trying to get into my room when I've got my desk with all my kids around it, and she realizes there's no room for her or him.
that. Yes, yes,
You
that's
know, I mean, to be able to see like what you're, yeah.
yeah,
It is a big ask to, I feel like SLPs, like we're constantly having to explain what we do. It would be nice if they took on some responsibility of doing exactly that,
yes,
taking taking the initiative to actually find out what we're doing.
right,
We're doing
right.
amazing work.
Absolutely. Absolutely. And so for your evaluator to know that, right, they need to be doing that. And I will say that's not something that you might be able to change, but it's certainly something that you can say. You can say, I'd really love for you to come see more sessions than just the ones that are set for the supervision and evaluation cycle, right?
Mhm.
So in the last paper, I should say the two papers, so the one that's being reviewed right now and the one that is published and I shared in the chat, in both papers, we found that sometimes SLPs are not observed at all for a year, right? And maybe you have this in your school in Connecticut, sometimes you have an off year, right? Where you're not on the evaluation cycle, so you
Right.
don't get observed. But that shouldn't be the case. There should be an informal standard where the principal or whoever else is in charge of evaluating you walks into your therapy room and says, hey, can I sit with you for 15 minutes while you work with, this student? And it doesn't have to be that they're going to write up anything, right? They can just have a conversation with you at the end. So the other part here, so yes, someone who walks the hallways and knows their people, important. Number two, someone who can give you feedback immediately, right?
Mm.
Maybe not on the spot right away because there's a lot going on, but at the end of that day, they check in with you and say, hey, I noticed this was so great about your session. I want to know more about X, Y, and Z. And now I say I want to know more because if you have someone who's a non-SLP, instead of saying, well, I don't know why you did, whatever, or Johnny wasn't speaking. Why wasn't he speaking? Right? Because maybe they don't understand the challenges that come with
Mm.
working with children who are nonverbal or have other challenges when communicating. So in the EDD program, we often talk about wonders or wonderings, right?
Mhm.
So what are your wonderings at the end of an evaluation? I wonder what Carolyn was looking to accomplish when she did this activity with Johnny, right?
Mm.
So then they ask, can you tell me more about this activity? Can you tell me in the past how Johnny has performed and what your expectations are for the future? And again, doesn't have to be formal. It's just a conversation where you can get to know your supervisor and your supervisor can get to know you. So your supervisor doesn't have to be a speech language pathologist to support you. I should say that, right? They don't
Okay.
have to be, but they do need to have the ability to get to know your work and to
So
understand it.
what advice would you give us SLPs if we are feeling unsupported?
Yeah, yeah. So as I mentioned earlier, right, a big challenge of the evaluation process is that it really doesn't reflect our work, and it's
Right.
not true only for us as speech pathologists, But this is where we can work with our colleagues outside even of the SLP team, right? So the years that I was in the schools, I was new and I had an amazing team, right, who were so supportive of me that I could at any time of the day text someone and say, I'm really stuck with this IEP. I need help, right? And then they jump in. So that was wonderful. But I also had a special ed teacher down the hallway who would be willing to look over my IEP and tell me if there were any errors, if there was something I needed to add, right? So building relationships with the people in your building is also important. And I think that that is really challenging sometimes, right? Because we get so caught up in like, well, I'm doing all of this and there's so much to do, but there's so much value into spending maybe an extra 5 minutes at the end of the day to go say bye to a teacher or to a special ed teacher in a self-contained room or to a specialist, right? And to build those relationships and then work collaboratively to say, well, how is supervision and evaluation working for you? What do you think are some things we can do, right? Because I think all of us as speech language pathologists have that spirit of leadership, right? To take on initiative. I say that to my students all the time. You guys, your main job is to be advocates for your students. So you need to really, really be good about advocating for yourself, right? Do not forget you. And so that's where this piece comes in. We want to see an administrator who is visible in the school, who is known, and but we can start by being that ourselves if we don't have that type of administrator, right? We can start by going out and reaching out and really making our presence known, because then other people will at least understand your role, right? Like your colleagues will know everything that you do and how you do it and your value. So that is, I think, a way to start advocating. I don't know how many people here, and I tried to look for this article. So it was an article from a group of SLPs. I think it came out last year in one of the ASHA issues. So a group of SLPs came together to advocate for better pay, better caseload numbers.
Wait, was this Julie Malone?
I think so.
She was on the podcast. She's my new
Okay.
bestie. It was yes, out of California.
Yes. So you have
She's amazing. She's now Asha's member at large. She did huge. Let me, okay, keep going. I'll see if I
okay.
can find it.
Yeah, maybe you can find the article. So I was trying to find this article because I thought, well, this is amazing, right? This is how you make change happen. If you are going to sit there alone and say, man, I really did not hit the mark with this job. I did not know that this is where it was going to end up. And you don't reach out to other people, right? So that's going to feel awful. But if you can build a network of other people who support and know what you're going through, right? And are going through the same thing likely because you're in the same district together, you can build a team to advocate for each other. And the one thing I took away from the research, thank you so much.
I'm all proud of myself right now. I'm all like pretty peacock.
Yes. So one part that I found was a theme in the last survey of the national survey of SLPs was that most SLPs who communicated that their district provided speech-based CEUs was because they mentioned we have SLP relevant PD because we have advocated for it. So it's not it's we have advocated for it. We as a team came together to the superintendent, to the director of special ed, right? And they gave us this PD because we asked for it. So big thing, right? Advocating and communicating. It's supposed to be like our biggest skill. But sometimes we forget that it is ours too, right? It's not just to give it to others. We need to exercise that skill as well.
I can't agree with you more on how important it is to advocate that, right? Just having a sit and listen to a PD that is totally does not really relate to us when our time can be used better when we're doing PD that really is specifically for us. And I love in the district I have, we have something called a job alike. And we all get together and there is power in numbers
Yes.
saying what we want and what speakers we want for us. And I absolutely love that sort of collaboration because SLPs, a lot of we don't advocate for ourselves and we should because we are
Yes.
really good advocators. So,
Yes. Yes.
yeah.
It is. It's a big thing. And I think, we all tend to do this, right? Even when we talk about health literacy with our patients, right? In other
Yeah.
areas,
Yes.
we end up falling short with our own health because we don't know how to advocate for ourselves sometimes, right? It changes.
But there's also this double edge here when we're part of the school system and we're wanting to feel like we're part of the school community, but we also do need to and really and understand that and understand how the system works. But we need to really focus on what we really do. We're not teachers.
Yeah, absolutely. So I think one of the other points here is that if you have some time to look through PACE, it is a very long document, right? So there's a framework, there's guidelines, there's a structure for a portfolio, there's a rubric that's included. So a couple of things that come with that are a evaluation that you can give to a parent, an evaluation you can give to a student, to a
Oh,
colleague, and to your supervisor, and you can do a self-evaluation, right? So part of the comments I received when I said to people, well, here's a tool, do you know about this, right? Was that's a lot of work
right.
because it is, right? However, I think PACE is a great starting point so that you can think of what are the pieces of evidence that I want to have in my evaluation to show my administrators the type of work that I am doing, right? To show them how much time I'm spending treating, how many evaluations I've written, how many parent meetings or education meetings I've had with parents, right? Outside of your meetings for IEPs. So data is important. So the same way that we collect data to show the progress of our students, we can use data to show our value, to show our needs, right? What do we need to do to help me succeed in this role, right? So that's really important. So that's where data comes into play. And so you can use those rubrics if you'd like, or you cannot use them and ask for something different from a parent. You can say, can you write me a letter to talk about the challenges we have worked through together to help your child this semester? Or you can ask a teacher, can you write me a letter to talk about how we have collaborated and co-taught this year or this last semester, right? However you want to term that. But you can really get information from others and support from others. That's data, right? So it doesn't have to be you showing, I did this and I did this and I did this. You can engage other people and have them advocate for you as well.
Kind of like it, like a letter of recommendation.
Yeah.
You know what I
Yeah.
mean? Like if you see it like that,
Yeah.
Yeah. And I think that's really powerful thoughts especially if you are slow walking your supervisor into understanding that you're trying to make a change and why you want the evaluation to really reflect what we're doing
Yeah.
by giving them, they're going to be thankful if you're giving them the data. Here you go. Here is whatever, wherever you want to go with that. Whether like my friend Annie was like, there's a population I want to learn more about.
Mm-hmm.
And so this is what I did. Here's my baseline data. Here's what I did. She took this course and then started utilizing the information and what she gleaned from that course, and then has data on the progress of the students I mean,
Amazing.
it's twofold. Not only is it showing initiative for her and evaluation of, evidence-based practice, but also to support advocacy for the importance. Like, wouldn't it be great if all SLPs then, would get PD that was really specific for them? And
Yeah.
that's where we're going to see the growth. So, I mean, I know I never like feeling like, oh, it's just one more thing we have to do, but we're doing it anyway. We might as well say, listen, I'm already taking progress on my kids. This is what the evaluation should be.
Right. Right. Yeah. And even if you are the person who is having to purchase your own professional development courses right now, right, then do this, right? So what Carolyn just shared, talk about the courses that you've purchased, talk about how that has informed your progress and even just your growth as a professional, right? So maybe not student data, but here are some things that I can do better or that I know I am going to do better because I completed this course. And use that to advocate and say, I would really love for my school to provide, right, relevant professional development in schools. So this is something that came up when I submitted the first paper and wasn't known in states. Check your education requirements, your law requirements, because some states will have an actual mandate that the school needs to provide a certain number of professional development hours per year. And so if the school is providing you with professional development that's irrelevant, you say, well, here's a document that says that the evaluation should lead to professional development that helps me achieve the goals I have set. How can you provide me with something that is relevant? Because the information I'm getting from the teacher PD is not helping me, right? It's not relevant to the goals I have set. So speak to it that way and see, how your administrator might come and get to a place where they can support you better.
I know early on in my career, well, not early on in my speech pathology career when I was a campus SLP, but when I was transitioning to feeding swallowing dysphagia and I was requesting specific PD for it, I offered that I would be bringing back this information to everybody.
Mhm.
Not everybody, but to like the speech paths, and then I could share with my fellow clinicians. I think that's a great support because I want to learn from my colleagues too.
Right. And that's a great idea because you can say, Carolyn wants to learn about feeding.
Mm-hmm.
Someone else wants to learn about literacy. Someone else
Yes.
wants to do fluency. So let's do that all on a day where we're separate, right? And sometimes then you have, I don't know if you do this in your current district, Carolyn. So there's professional learning communities as well, right? So there are days where the whole SLP team in a district might get together.
Yes, yes, they call it job alike, but that's
Okay.
exactly that, and I love it. I absolutely love it.
Yeah. And so you might say on the days we're not together, we'd like to complete individualized professional development. And
Mhm.
then we can all share with each other what we have learned when we come together to that learning community, right? And then we can really grow as a community.
Right, because as we know, there's usually one SLP on the campus versus how many teachers, and so they already have their hive. And
Right.
so if we can, and depending on your district, I've been in two very large districts, but I've also have colleagues that are in very small districts and have very few SLPs and they're far away. And
Yeah.
so even if you guys could come together, even, and now you've got your community, I think that's powerful.
Yes. And Zoom makes so many things possible.
Oh, right, right. I love that we have that opportunity, the virtual now that we can talk so much easier because we do have that option. And to advocate for collaboration with our colleagues.
Absolutely.
I know that we collaborate, in our stack with, in our school, but we could do that more. We could
Yeah.
do more with our colleagues as well. Yeah.
Right.
And of course, data supports, shows the need for that. So since we're good at data.
We are.
I know we are. But I think it also, you touched on earlier of how important it is to really become strong allies with the multidisciplinary teams, with the psychs, with the other related services, and see what they're doing, what's working for them.
Right.
How are they being evaluated? Right?
Yes.
Yeah.
Absolutely. I will say that that goes a long way. And, I say we're not the only ones who feel this way because we truly are not, right? So my colleagues who were the social worker, the school psychologist
Yes.
felt similarly and they felt stuck, but we just comply sometimes. We fall into that rut of just saying,
Mhm.
okay, I will go to another PD that's irrelevant to me. I will do
Right.
this activity.
And I think because we feel like we're just one little voice in the sea versus if we had the other related services that I love that you said social worker. I didn't even think of that.
Yeah.
But the counselor, definitely the psych, definitely the OT, definitely the PT. How about the vision,
Yes.
right? Any nurses? Well, actually nurses have their own thing. They're pretty good. But I'm just trying to think of everybody out that I can possibly say. But if there is a community on each campus that would be a bigger voice than just one, because I think it is kind of intimidating to be the voice of one. But
Right.
if you got together with your other colleagues.
Yeah, and that's where building those relationships becomes so helpful, right? To
Mhm.
reach out to your team and get to know them, understand their frustrations as well, right? Because they're going to have some frustration on, the resources, access to professional development, opportunities to collaborate. So building those relationships is really important so that you can advocate for each other, advocate together.
Advocate for each other and together. I love
Yeah.
that. And also, yeah, have clarity to
Yeah.
see who's getting what and hey, us too, you
Yeah.
know?
Yeah.
Yeah, absolutely. Because I think it is important that we are like I do truly love collaboration and within the teaching community. I absolutely I think that's, the education. We're here to support education, but I also think it's also important for us to protect our professional identities, uh,
Right.
being speech language pathologists.
Right.
I
And
think,
even, that's a big thing because sometimes people don't really, because our roles started off with
mhm.
articulation and fluency, many people still think that that's all we do, right?
Yes,
So you go to them and you say, well, I also work, with children who have cognitive communication challenges, who have social pragmatic disorders, who are on the autism spectrum and require assistive devices. I have expertise in that area, right? And then they're like, what?
right.
Also that you do that too, right? And they won't know that unless you make that known to them, unless you tell them, this is my entire scope of practice. I have been trained to do all of these things, not just speech and articulation and fluency. Those are not the only things that I do.
Because a lot of times, because we just hear speech.
Yes.
Oh, they're speech only,
Yes.
right?
Yes.
Or they're the speech teacher, which is not the same as, the educator that teaches speech
Right.
and giving speeches versus the speech language pathologist. But even then, that doesn't, I can't tell you
Cover.
how many times people, when I say what I do in outside of the community, and I say, well, I'm a speech language pathologist, I specialize in dysphagia, swallowing, and they're like, what? Like, how is that even, so yeah,
Yeah.
I mean, the
Yeah.
struggle's real, people.
Yeah. And even, so this is one thing I did early on with one of my colleagues. We had both arrived at this district pretty early on and decided, okay, we're getting all these referrals for things that are one, not really a concern,
Mhm.
or two, could be phrased differently, right? There's something different going on that maybe the teacher's not understanding or someone else in the team is not understanding. So on one of those PD days, we said, hey, can we give a presentation to our school team? Right. And so that was an opportunity to educate our school team and to say, here is what SLPs do, and here's all the training. And most of the people in that room did not know that we were required to have master's degrees to go into practice, right? So that was a big eye-opening moment. And then to look at all of the areas in which we are trained and all of the skills that we can support students in developing.
Absolutely. I can't support that enough on how important it is to educate your community on what we do, what we can do, and specifically in through the lens of education. I mean,
Right.
we really do have to balance the fact that we are here to support education, yes, but we also need to protect and who we are and what we do, because we're not
Absolutely.
just a teacher. We're not that's not what we're here for. And I think when we really truly have proper supervision and evaluation of what we are, and everyone understands what we're supposed to do and what we're capable of doing and how we are supportive, that I think that's a win-win,
Yeah, absolutely.
you know?
Yeah, it definitely is. Yeah.
Oh,
Yeah.
boy. I love this because I think it's made me think, especially because I brought it up. I've been talking about my friend Annie all day because knowing that we were going to talk, I was talking with her, that that's something that I think is affecting all of us. Um,
Right.
Having that proper and since we do, we provide free and appropriate public education, perhaps we would like a free and appropriate public evaluation.
Yes. I love that. That's the new FAPE.
That's our fate.
Yeah. I love that.
Oh my, I am such a dork. I love it. Okay, I just want to make sure, I mean, I know we're getting to the end and I can't stand it because I'm never ready for my episodes to end. And I don't want it to end. I just want to make sure that we've covered everything. If you could leave SLPs, the school-based SLPs that are with us today, with one mindset shift or something about supervision and evaluation, what would it be?
Yeah. So I think a big one for me is I have power to change so much. I
Mm-hmm.
just need to look at the very smallest thing first, right? I can't look at the whole thing and be overwhelmed and say, oh, this is too much for me to do. Start small.
Yeah, because that's
And
task paralysis for me
yes.
when
And
it's
that is,
too
you
big.
know, reaching out just to the person who's in the next room,
Yes,
talking
okay.
to them, and you haven't taken the time to build that relationship, start there. And if your supervisor is someone who intimidates you, lose that.
Yeah.
I'm going to say lose that because one thing I tell my students is we're on the same plane,
Mhm.
because especially as an educator, your students might see you like, wow, Miss Dolby, right? She's up there and I'm
She's so
down here.
cool.
Lose that.
Oh,
We're all on the same plane here. We all make mistakes. And sometimes people are just not great at navigating relationships,
mhm.
but facilitate that, right? We're social communication interventionists.
Right. Right.
We can do
Right
that.
on.
So,
That's our superpower. So we
yes.
can do it
So
for
start
ourselves.
small and use your amazing SLP skills. You have it. You have it in you to make it, right?
I love it. Jackie, thank you so much. I am so tickled that you were here. You're so present and you shared so much with us. Thank you for having all those links. I mean, we eat that up. We love
Thank you.
it. I love that it felt real. It felt the conversation real, and it hit home on that we really need to advocate for proper supervision, proper evaluations, so that we are getting our needs met when it comes to the support that we need in order to do our jobs, which we're doing amazing,
Yes.
right? I love it. Thank you, everyone, all my listeners. Thank you so much for being with us today. Thank you, everybody, for what you do every day in the schools. Our work is so complex. It's so Well, it can be kind of misunderstood sometimes, but it matters so deeply. So, all right, y'all, if you love this episode, I want you to leave a review, share it with your fellow SLPs, spread the word that we're out there. Let me know. Drop me a line and let me know what other topics you're interested in. And Jackie, I know we already talked that we want you back when your next paper's out because it's just so fun to listen to you. I love it.
Thank you.
All right, you guys, until next time, keep it up, keep advocating for ourselves. That's my takeaway. Keep advocating for ourselves. All right, guys, thanks so much. Bye.